Hello all.
Yes, I'm Dr. Vishwanath. I'm a senior consultant and academic advisor in the Department of Medical Oncology at Apollo Hospitals Bengaluru. Today it's a very proud moment for Apollo Hospitals Bengaluru. We have launched our comprehensive stem cell transplantation unit, where we are able to do autologous stem cell transplant, allogenic stem cell transplant and cellular therapy or CAR T cell therapy under one roof at Apollo Hospitals Bengaluru. So it is a state-of-the-art unit, and we've got excellent support from our consultant colleagues as well as infectious disease experts, nurses and of course our higher management. So talking about cellular therapy, which is also called CAR T cell therapy, it is a procedure which is done for high-grade B-cell lymphomas which are relapsed. These patients generally have a survival of only 6 months to 12 months. But with this procedure called CAR T cell therapy, where by a simple procedure called apheresis, we remove the patient's T cells and we send it to the lab where it is genetically modified, and it comes back in 2 to 3 weeks and pushed back into the patient's body, and then the patient is monitored for 2 to 3 weeks. With this procedure, we are able to cure around 50 to 60% of our patients with high-grade relapsed B-cell lymphomas, which is actually a deadly disease. This procedure can also be done for childhood leukemias, where again the cure rate is in the tune of 50 to 60%. And this novel procedure is not done in many centers in the country, and Apollo Hospitals Bengaluru Road is one such center where we can provide this novel procedure at a cost which is 1/10 of what is performed in the United States. There it's around 5 to 6 crore rupees. Here we are able to do it at 50 to 60 lakh rupees, because it requires a huge infrastructure. The product itself is around 30 to 35 lakhs. The cost is coming down. I'm sure in the next 1 to 2 years the cost will come down further, and we will be able to do more and more patients and treat these patients successfully. Thanks.
Sir, after undergoing the CAR T therapy, any chances of relapsing?
So that's a very good question. Like I said, 50 to 60% of the patients who undergo CAR T cell therapy can be cured, but there are certain resistant cases, around 40% of them, where it is difficult to cure. And like my colleagues did mention during the discussion, that further therapies like BiTE antibodies and some novel targeted therapies are being used post CAR T cell therapies also, and we are able to cure a minute, maybe around 20 to 25% of those resistant cases.